All right, guys, so today I'm going to show you guys how to do range of motion of all of the main joints. Please, again, as I always say in the videos, make sure that you look at your hospital policy to ensure that you're following all of the correct protocol. So whenever you're doing this, again, if your patient is weak or you're doing it on somebody else, you want them to be lying flat in bed. That's just the best way to keep them safe so they don't fall. So I'm going to start showing you guys some of the range of motion. Whenever you're doing this on a patient, also you want to feel that joint. That way you can feel if there's any crepitus, that grinding of the bones. So I'm going to turn sideways here. When you're doing that neck range of motion, you want to flex. Remember, flex is always forward. So I'm going to flex my neck forward. Then you're going to extend, so extend that neck back. Then we're going to do some lateral bending. So lateral bending is just side to side. You tell that patient ear to shoulder. And then right and left rotation, just tell them to look over their shoulder. Then we think about that TMJ, that's that temporomandibular joint right here. So when you're doing that, you want your patient to open their mouth and close it. Then lateral deviation, which is back and forth, side to side. And then when you have them protrude, you want that jaw, the bottom jaw, to go out. And when you retract, you want that bottom part of the jaw to go in. All right. Next, we're going to start thinking about these upper extremities. So when you look at the shoulders, first thing you do with the shoulders is you flex. Remember, flex is forward. Then you're going to extend, tell that patient to go back like they're flying like Superman. Then you want them to abduct. Remember, that's with the B. So we're going to abduct. And then when we adduct, that's ADD, you're going to add it back to the body. Then you want to do internal rotation. Tell the patient to put their hands behind their back like they're going into jail. And then external rotation, hands behind your head like you're relaxing on the beach. All right, then we go to the elbows. So with the elbows, you want to have them flex. That's those elbows going up. Then extend, going straight out. And then you got to think about pronation and supination. So remember, supination is like you're holding a cup of soup. So your hands have to be up. Pronation, you put your palms down. Then to look at these wrists, to make the person flex, remember, flex is forward. So you're going to flex your wrists down, extend your wrists up. And then we got radial deviation. So remember that radial side, remember your thumb looks kind of like an R. So radial deviation is thumbs towards each other, and ulnar deviation is thumbs away. Then with fingers, you can flex them and you can extend them. Next, I'm going to go ahead and go to the lower extremities. So this is really where you want that patient to be in the bed to be safe. I'm going to only do it on the one side right now. So first thing you want to do is have the patient flex. Remember, flex is forward. So we're going to flex all the way forward. And then we're going to extend. You want to extend all the way back. When we abduct with the B, go away. And then we adduct, you go back. Then internal rotation, you want to have them bend that knee and turn that hip inside. And external rotation, put that leg out this way. Don't forget, do the other side. Flexion, extension, abduction, adduction, internal rotation, and external rotation. Then looking at the knees, they can only do two things. You can either flex them, extend. Again, flex and extend. All right, now we're gonna go down to the feet and the ankles. With the ankles, you can have your person dorsiflex. So when we dorsiflex, we put our toes straight up. This. Think of a dorsal fin. It's on the top of the fish. Then we think about plantar flex. You plant into the dirt, so that's pointing the toes down. Then when we invert, put the foot in like that. And evert or exvert, you put the foot out like this. So we're gonna go over here. We're going to plantar flex. Remember, that's down, planting in the dirt. Dorsiflex, just like a dorsal fin. Invert, toe in, evert, toe out. Last thing we gotta think about is that spine. So when we think about our patient's spine, you want them to flex. Flex is forward. So we're gonna go up this way. Then you want to extend, have that patient lean back. Make sure you're there for support so they don't fall. Then we're gonna do lateral bending. So just have them reach down to the side. And then you wanna do bilateral rotation. So this way and this way. That's it.